So happy that you brought this up. First off, yes, certain supplements like cranberry tablets and extracts of cranberries like diamanose have been shown to help prevent recurrent urinary tract infections. But azo is one of those medications that I typically avoid, and I want to tell you why. First and foremost, the primary goal of azo is for pain relief during a urinary tract infection. I would not compare it to an antibiotic. Years ago, I had a patient that came in with symptoms of weakness, fatigue, shortness of breath when she exerted herself, and on exam, she was very pale and she was very tachycardic, or her heart rate was fast. And these were all the signs and symptoms of acute anemia. And it turns out that her complete blood count proved that. She was so anemic that she had to be admitted to the ICU for workup as to exactly where this came from. On day 2 or day 3 of her admission, she just was talking to a medical student and happened to share that she was taking a supplement for treatment of a UTI, and that supplement was azo. What she did not know is that she also had an uncommon genetic disorder that resulted in a deficiency in a key enzyme called G6PD. G6PD stands for an acronym that's just too complicated for this moment, but the actual function is really important. The enzyme helps to control and reduce oxidative stress inside of our red blood cells. I just want to take a second to talk about this enzyme deficiency and its relevance in history and evolution. So there are certain regions of the world where there is a higher percentage of people who have this deficiency, for example, in the Mediterranean and in Africa. And the reason behind that is actually one that can be found through evolution. So remember, this enzyme helps to control oxidative stress. So if you have a less amount of this enzyme or no enzyme at all, you have more oxidative stress, which makes it a less hospitable environment for bloodborne